everybody, I'm Dr. Hemant Thakkar from Mumbai. I'm a cardiometabolic physician, and on this World Diabetes Day, I'm here to emphasize that a lifestyle disease should be treated with lifestyle changes. No matter what medication, how expensive it is, how injectable it is, how oral it is, or how economical it is, all those have to be complemented and finally overtaken by sustainable lifestyle changes. We know that diabetes is swelling at an alarming proportion all over the world. The International Diabetic Federation has said that currently there are 540 million people approximately in the world with diabetes, which will swell in 2045 to 780 million. Now, this is an epidemic which is just exploding and multiplying. So we have to find a way to manage diabetes effectively. Now, we know through so many studies that even a 1% decrease in HbA1c can improve the life expectancy by almost 20%. The incidence of heart attacks, strokes, peripheral vascular disease, and all these conditions go down significantly if the A1C goes down by a mere 1%. And for this, to make this possible, we have to have a focus on a few factors which will help the patient, his psychological well-being, his positive mindset, and all put together to achieve a target. You cannot just keep whipping him with medication. Look at what you can do for his lifestyle. The most important thing is food. Food is now not counted as proteins, carbohydrates, fats alone, but you count it as calories. You count it as plates. You look at the foods which are good and foods which are bad. You don't deprive a patient of food, you allow him to choose the right food. And giving the right food at the right time, in the right proportion, in the right admix, along with his medication, can prevent patients from tipping into hypo or hyperglycemia. Because hypoglycemia is probably worse than hyperglycemia. So if you are able to tailor his food, to outpoint his diet, take the family into consideration, look at his financial well-being, his social well-being, and his ability to comply with them at work and at home, and then tailor something. Remember, every patient is a single unique patient, and one size cannot fit all. This leads to the second point, weight. Unless the patient is able to marshal his activity, his food, his drugs, and his mental well-being, his psychological well-being, to reduce weight or to bring his weight to optimum levels, it's not going to work. Management of weight effectively is a function of everything: exercise, diet, and mental well-being. Coaxing him, teaching him, allowing him, giving him the choice, but still keeping his weight under check. Which leads me to the third factor, and that is physical activity. To reduce weight, we have already talked about food. We have to talk about physical activity. 150 minutes every week of good physical activity, or 75 minutes of vigorous physical activity with couple of days a week of weight training, helps the patient to keep his calories in check, to keep his muscles in check, and allows him to mix these physical activity cycles with good foods which are nutritive, and allows him also a little cheating, because he is human. You can't sentence him to a lifetime of strict diet and strict activity. You have to allow him his diabetic date. When you talk about exercise, you have to guide the patient about what time, depending on his previous meal or next meal, and depending on the dose of anti-diabetic that you are prescribing. Simultaneously, take away nicotine, smoking, chewing, vaping, anything in the form of tobacco should be kept out, because tobacco causes micro and macrovascular problems in the diabetic patient. More so in the diabetic patient. It causes problems in all patients, but the diabetic for sure. So wean him off his nicotine, and that will help him also for good glycemic control. Remember, a complex, multifaceted behavior depending on emotions, social, clinical, depending on family, and so many other factors have to be molded together to allow the patient to think positively, to not go into depression because his disease is a way of life. It's not a fever, come here, gone tomorrow. He has to live with it. His family has to live with it. And he should not feel deprived as compared to his other colleagues in office or his other people at home. So psychosocial factors to mold the psychological well-being of your patient is extremely important. If you look at these 4 or 5 factors, from food to weight to addictions to exercise and psychological or psychosocial well-beings, and you give the right pressure and the right ingredient to the right patient, tailor it in conjunction with the people he lives with, the people he works with, and the people he likes, and you will have a great finished product which is sustainable. Because you give the patient insulin, you give the patient some strong drug, it's a flash in the pan. Whether he is going to keep it up, whether he is going to continue injecting himself, but you give this patient a lifestyle change. Teach him his exercise. Tell him what is good food, what is bad food. Keep his mind relaxed. Counseling, molding, thinking for him, teaching him, making him emboldened. He should learn about his disease. He should know about his problems, and he should be then taught to sort out his problems. All this put together can produce a great finished product, and that is a good result of diabetes therapy, because lifestyle change is still the first and the most important armament in the armory of a physician, which can continue at any and every age in both sexes, and which will pay dividends at all phases in life. On this World Diabetic Day, I do not want to talk about newer medicines and newer compounds and newer methods of detection. I want to talk about lifestyle, something that begins at home, something that can be taught over a table, counseling table, something that can be helped as the form of exercise or food. And it's a small step at your level to indulge in this for your patient, but it will be a giant leap for his diabetic control, and the sustained diabetic control will be his giant dividend, because all the problems of macro and microvascular dysfunction of organs will be alleviated or curtailed. Here's to lifestyle change on a long-term basis. Thank you for listening to me.